Exposures during international travel will continue to be reported to international authorities as required. Exposures to cruise ships will continue to be reported to Public Health Agency of Canada and reported on their website. So again, this is in keeping with a lot of the preventive measures in place that we've seen now. It's in keeping with the risk of what we've seen of exposures in these areas, and what we know now with vaccines and practicing the fundamentals. So when planning for travel, consider assessing your risk with that destination in mind. And so for information on travel, including travel notices, you can visit the Public Health Agency Canada site. Again, as we talk about those fundamentals, very important to be staying home when you're not feeling well, and then to go for testing right away. This sometimes creates some inconveniences, some difficulties for individuals, but really is what we need to continue to focus on as we make our way through this fourth wave. The other reporting change is that related to variants of concerns. We've learned about these variants over time. We first saw that Alpha variant that drove much of our third wave here. We came to know other variants, Beta, Gamma, and then now Delta, what we're dealing with in our fourth wave. So about 98% of COVID cases in Manitoba are Delta cases. So because of this dominance, there's really no benefit clinically or from a public health perspective to report this information. It's the dominant strain by far. And so we're going to discontinue the public reporting of variants of concerns. After November 26th, they'll not be posted online or indicated in a reference to deaths in the bulletin. So again, this doesn't affect public health practice. We're still going to be monitoring for variants of concern and screening and sequencing of samples to ensure there is no change in our epidemiology. But there's just no really real benefit in reporting this, as almost all cases diagnosed in Manitoba are that Delta variant. So all of our medical officers of health still have the opportunity to discuss with the lab experts or request additional information on a sample. And then, of course, if there's risk to the public, more information is made available. So again, this doesn't change much of our public health practice. It's just more of a change in the reporting. Flu season is nearing us again, and just like last year, it's like every year, it's really important to get that flu vaccine if you're eligible. Manitobans 6 months and older are eligible for that vaccine. So we have many doses available. Certainly not too late to book an appointment. Seasonal flu cases remain low at this point. At this time, 17% of Manitobans have got their flu vaccine to date. Again, there's some delay in the reporting of these vaccine uptake, so usually that's a bit of an underestimate of how many, but we certainly want to see that number climb. We want to ensure we are not putting that additional strain on our healthcare system at a time when it's already strained, when we're dealing with COVID-19 and backlogs. So again, that flu shot is a great way to protect yourself and the people around you from the flu, which can be quite a severe illness as well, especially those people who are at significant risk. Those are, those over 65, those under 5, those underlying medical conditions, or people who are around them. So really encourage Manitobans to contact your healthcare provider, pharmacy, get that flu shot as soon as you can. A couple things to clarify regarding vaccine status and proof of vaccine. Individuals aged 12 to 17, if you're fully vaccinated, we recommend that they use their Manitoba immunization card to prove they're fully immunized. We know the public health order for recreation activities only requires a minimum of 1 dose. So we certainly suggest everyone get fully vaccinated as soon as they can. But that exemption does allow just those with single vaccines to be exempted. And then so in this case, you wouldn't have that proof of vaccine card. So a printout of the youth immunization record is an acceptable medical record for those purposes. For that 12 to 17-year-old group for recreational purposes. For all other areas that require proof of vaccine, you're going to need that card. The second issue related to the vaccine, proof of vaccine, is clarity for Manitoba businesses and venues. So all Manitoba residents are expected to show a QR code from the Manitoba immunization card or their pan-Canadian proof of vaccine credential as a proof of vaccine. So we set out additional information online with what we will accept from people who live in other provinces, their territories, or their jurisdictions until that pan-Canadian credential becomes more widely implemented. So thanks. I'm going to pass it over to Dr. Reimer now.
Thank you, Dr. Roussin. I'm Dr. Jos Reimer, medical lead on the province's vaccine implementation task force. This has been a very exciting week for Manitoba families with children aged 5 to 11. As we know, Health Canada approved the use of the Pfizer community vaccine for kids in this age group, and we have launched the Protect MB Kids campaign as well. Our provincial call center and online booking system began accepting bookings for pediatric appointments at 6 a.m. on Monday. On the first day, 18,693 appointments were booked for children aged 5 to 11. On Tuesday, an additional 3,351 appointments were booked. And the total we've reached so far today is 23,310 appointments and counting. This is so impressive, and it underscores what we knew, that Manitoba parents of younger children want to get their children vaccinated to protect them from COVID-19 and to help protect the whole community. Today, some of the first appointments are taking place for children to receive their vaccine. Today's appointments are taking place because we received shipments of the vaccine as expected yesterday, but early enough in the day that the team was able to inspect, repackage, and ship some of the doses even earlier than anticipated. We wanted to make sure that people could get in for appointments as soon as possible, so it was exciting for us to be able to open up appointments for today. The pediatric doses are being distributed province-wide and will be administered through regional vaccine clinics, physician clinics, urban Indigenous clinics, pharmacies, and pop-up community clinics. The vaccine will also be available in some Manitoba schools, both during and after school hours, in the coming days and weeks. Pharmacists can now vaccinate children in this age group, so your local pharmacy will begin offering appointments once they receive shipments of the vaccine. So you can check with your local pharmacy to find out when they're taking appointments. But on top of that, we do have the provincial vaccine finder map on our website. So you can check that site out to find a convenient place to go close to your home, your work, or maybe your child's school. It has been updated to include which pharmacies and clinics will be receiving the vaccine, but keep in mind that they do not yet have any vaccine. Some will start receiving the vaccine as soon as tomorrow. Manitoba will be receiving enough vaccine to provide a first dose to all 125,000 children in this age group. So we're very thankful that we do not need to prioritize doses for different children within the 5 to 11 group. Our provincial vaccine team is quickly distributing the product, and immunizers are also receiving specialized training in techniques for immunizing younger children. So I encourage you, if you are a parent or a guardian, to begin having conversations about vaccination as a family and prepare your younger children for the experience. Just like adults, children have questions, and they want to hear that the vaccine is safe. The scientific and medical evidence is clear. The Pfizer pediatric dose is safe and will be highly effective at limiting the spread of COVID-19 and protecting children in this age group. Health Canada completed their review and indicated that the choice to not vaccinate your child in this age group carries more risk than the choice to vaccinate your child. Parents can feel secure and comfortable that they're making a very good health decision to protect their child through vaccination. But that doesn't mean that we won't continue to watch. And we do want to continue to collect information as it comes in, and we'll share with Manitobans if anything changes. The recommended interval between first and second doses for children aged 5 to 11 is at least 8 weeks. So unless you live in a First Nations community in Manitoba, this is the interval that we will be using. We will also be keeping an eye on the US to learn from their experience immunizing this age group, as they began earlier than we have. And we are always looking to improve our recommendations to be consistent with the most up-to-date scientific information available. As well, it is recommended that children should wait at least 14 days between receiving the pediatric COVID-19 vaccine and any other type of vaccine. The 14-day recommendation from NACI is to help us better understand side effects. When you get 2 vaccines close together, a symptom that you experience might be due to vaccine number 1 or vaccine number 2, or something completely unrelated. Splitting up the timing of the 2 vaccines narrows down the cause to only the 1 vaccine or something completely unrelated. So let me be clear for Manitobans and for parents specifically. There are no safety or effectiveness concerns about your child receiving a different vaccine close in timing to their COVID vaccine. So please don't cancel any existing appointments that your child has for flu vaccines or school-based vaccines. We don't want anyone to purposely go and get or book another vaccine close to the COVID one, because the surveillance is important to our understanding of this vaccine. But we also don't want your child to miss an important vaccine when it's being offered at their school, for example. New COVID cases are rising amongst children faster than any other group. And right now we have an opportunity to do everything possible to keep our kids safe, to limit disruptions to their lives at school, in their recreation, in their social lives, in the activities that they love, and with their friends and family. As the holiday season rapidly approaches, so will the opportunities to gather with family and friends. When kids are vaccinated, they are safer, and we are all safer. With the 8-week interval, kids will not be fully vaccinated before family gatherings start. But even 1 dose will help protect your child and help protect your family. So this is a great addition to all of the other measures that you're already taking to keep your family safe. Our call center and online booking system is clearly able to meet demand now. And until all Manitoba kids in this age group are vaccinated, we will be able to continue to meet that demand. I encourage parents and caregivers to visit our website for clinical information, answers to frequently asked questions, and the Protect MB Kids resources that are for both parents and kids. Shared Health also is working on materials for kids. For example, they created a video for children with one of our local pediatricians, Dr. Lee, along with his friend No Name. And Dr. Lee gives your kids some helpful information about what to expect when they go for their vaccine. This week, I also very much look forward to a special event where we will celebrate some of the first doses delivered in Manitoba to kids aged 5 to 11. And with that, we can move to questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have 1 preliminary and 1 follow-up question. Up first this afternoon from the Winnipeg Free Press, Katie.
Good afternoon, Dr. Reimer. Do you have an update on the 3rd dose rollout in personal care homes? Do you know how many homes have finished administering the 3rd doses?
All of the personal care homes in Manitoba have offered 3rd doses to their residents. So at least the initial offering has occurred at every personal care home in Manitoba. There will always be more individuals who either become eligible because they've hit their 6-month mark, or make the decision to move forward with the 3rd dose when they hadn't previously. So we expect that those numbers will continue to increase over time. But we were very happy to see that at least the initial rollout has been completed at all of our personal care homes.
Thank you. Dr. Roussin, are public health officials tracking the levels of transmission among fully vaccinated Manitobans? And do you have specific data that shows just how much less likely fully vaccinated Manitobans are to spread the virus?
So we do our typical contact, investigation from it. It's sometimes difficult to the acquisition events are always difficult to measure, right? Because it's somebody who developed COVID acquired it at some point during that incubation period, that 14 period and day period. So they've been in a number of circumstances. So it's always tough to pinpoint the acquisition event. What we know is that vaccinated people are much less likely to develop COVID, so therefore much less likely to be able to pass that on. From various studies, we see that those who are vaccinated, who do in fact develop symptoms of COVID-19, will typically be infectious for a lesser duration of time, which makes them less likely to pass it to people. So there's a lot of benefit to being vaccinated. And in addition to that, one of the biggest benefits is it dramatically decreases your chances of having a severe outcome.
From Global News, Brittany.
Hi, good afternoon, Dr. Roussin. A few weeks ago, you gave us some projections on the path that we could be on when we hit December. We're kind of ranging between that 150 and close to 200 cases per day, almost every day now. And we're seeing just in the last 13 days alone, 30 deaths. I'm wondering if you can just, give a bit of an explanation for that and whether or not you're concerned with this and where that projection is looking now.
So yeah, I mean, anytime we see severe outcomes, certainly including deaths, right, we're obviously concerned about that. If we look at the the amount of deaths overall compared to the pre-vaccine waves, where we have shown a significant improvement on that, we still are seeing that upward trend in cases. As of late, the ICU numbers have been staying relatively stable, but we know that healthcare system is under strain, and that as cases go up, we certainly need to be concerned that the number of admissions to hospital and ICU will trend up. So, so certainly our modeling does show upward trending for the next number of weeks. That's how many weeks we tend to look out. But we are seeing a lot of fluctuation. We're seeing days where test positivity is increasing, when other days where it's decreasing. We're seeing, our test positive numbers climbing over time, but also not at an exponential rate. So certainly we're at a concerning point. But it's clear that vaccines have changed the trajectory of this wave.
When we talked to you a few weeks ago with the health minister by your side, Minister Gordon said that she could be sitting back here in just a matter of days implementing new restrictions and you guys wouldn't be waiting. Do you think that the restrictions that were recently put in place are working? And if not, what tools do you have left to stop this path, and how long are you going to wait before you implement those?
So it's a little difficult to know the effects of the restrictions that we implemented at most recently, and when we look at a number of things as we move forward, we've always looked at those test positive cases, the test positivity. What we find, right now is that the severe outcomes are what's, what would really drive us to be concerned enough to implement any other restrictions. So we don't have any immediate plans, on that. We definitely look at it, and where what things are open. There's always the ability to speculate. we know this is spread in indoor public gatherings. We know that the unvaccinated are much less or much greater risk of acquiring COVID, much greater risk of having severe outcomes. So any restrictions going forward needs to, focus on those type of ideas.
From the Brandon Sun, Karen.
Good afternoon. Just wondering, especially as flu vaccines are rolling out, are there any concerns about perhaps severe outcomes in flu, because we haven't had a whole lot of exposure there for the last 2 years because of restrictions? And are you hoping that there is going to be a really strong uptick in vaccines this year just to try to dampen any kind of like second outbreak or mass infections?
Yeah, well, definitely. This is why we're really promoting the flu vaccine every year. We do that. We feel the flu vaccine is very safe. It's effective. It's the best way to protect yourself and the people around you. And we know that these years it's even more important because our system is already on strain. If we have COVID numbers increasing, add to that influenza numbers, which every year put a strain on the healthcare system when it's circulating. So definitely flu vaccine is a great way to protect yourself and others. We're concerned about other respiratory viruses, RSV. We see a resurgence of that in some other jurisdictions, and that affects younger children and can lead to severe outcomes. So those fundamentals that we're always speaking about remain very important, not only for COVID, but the transmission of all of these respiratory viruses.
And also, I had received a call from a reader, especially in the area of St. Lazare. She's saying there's a lot of people that aren't following restrictions and infections are going up. So what I wanted to know is that when does the municipality step in and start doing stricter enforcement? Do they have to wait for the province, or can they do that on their own?
So we've had, measures in place for quite some time and various forms of enforcement. So we have an enforcement table that does a lot of engagement. And we know that there's been times, where Manitobans, throughout the province have not, followed the recommendations, and we know that can lead to more transmission. So, as far as the enforcement, we have the table. We have our colleagues from Justice who have always been working on the enforcement measures.
All right.
From CJOB, Clay.
Yeah, sorry about that. Yeah, my questions have basically been answered with the exception of one. Dr. Roussin, every time I turn around, I'm looking at health officials advising people in the United States to once again avoid large indoor gatherings, family gatherings, as Thanksgiving is there tomorrow. Christmas is looming. The Christmas holiday season is looming here. Any update on your advice for people who are planning on big family get-togethers?
So we're going to have, some specific recommendations from that. The overall theme remains the same, right? Is that, the best way to be able to get back to these type of things is to be vaccinated. Whether you're vaccinated or not, we need to follow those fundamentals. We need to ensure that we, are staying home when we're ill, washing our hands, trying to have some of that distancing. And overall, we're still, at risk. So I don't think it's a great idea to have, crowded events. Especially if there's unvaccinated individuals in there, and that includes people who are not eligible to be vaccinated. So we're going to have some more guidance on there, but we really want to ensure we get a large uptake of the vaccine. We have a new eligibility cohort here, which we see already great enthusiasm because we really want to see our trends declining, going into that holiday season where we know that there's going to be a lot of gathering taking place.
Thank you.
From the Winnipeg Sun, James.
Yeah, good afternoon, Dr. Roussin. Based on what's happening around the world, I think there's a fresh lockdown in Austria. Some people are afraid there'll be no end to the pandemic and that vaccines aren't working. So how do you allay those fears?
So all pandemics end, and this one will end. The vaccines are most definitely working. No intervention that we've ever have in pandemics or anything is 100%, and vaccines are 100%, but they have dramatically decreased transmission. They have dramatically decreased severe outcomes in those who have taken us up on the vaccine. So, and then if you look at many European countries, again, I don't have the specifics of any specific country there that's requiring lockdowns, but our vaccine uptake has been in general better, and so you can really see in areas in Manitoba where we have very high vaccine uptake, our transmission has stayed fairly stable. So this will come to an end. It's hard to know when exactly it'll come to an end, but if you look at the our second and third waves and the numbers of transmission, the numbers of test positive we see now, and the things that Manitobans are able to do, you can see the benefit of that vaccine. Right, we're having large sports events. We're having the vaccinated going to restaurants, where these things were all shut down in previous waves, and yet we still see our numbers, while concerning, certainly haven't seen that exponential growth that we saw in various waves. So absolutely vaccines work, and absolutely they are our way out of this pandemic.
Thank you very much for that. And just in terms of vaccinating kids, Dr. Reimer mentioned protecting children. So that begs the question, how many children in Canada or in Manitoba have been severely affected by COVID-19, and why vaccinate them?
I can take that one. In Manitoba, we've had over 6,000 infections in this age group. So this isn't even just all children, just the 5 to 11 age group. We've had 27 kids in this age group end up in the hospital, and 7 end up in the ICU. And we even had 1 child in this age group lose their life due to COVID. So we're thankful that this virus does seem to be less severe in most kids than it is in older age groups. But it's still causing a lot of illness. It's still causing a lot of disruption. It's causing some severe outcomes for some children, most of whom didn't even have high-risk health conditions that would have put them at higher risk of ending up in the hospital. So this is a great way to protect kids against ending up in the hospital, ending up in the ICU, which is an extremely traumatic experience for a child and for their family. It also is a great way to prevent against the long symptoms of COVID. Some children, and again, thankfully, it's not a high percentage, but some children have symptoms for months, which can impact their learning if they're having difficulty concentrating. It can impact their recreational activities if they're having shortness of breath. And we also see children developing the multisystem inflammatory syndrome, which is a severe illness that can happen weeks after an infection. And it can end up with hospitalization, and many of those children end up in the ICU as well. And then we also want to see their lives not being so disrupted. So they're being impacted as much or maybe even more than the rest of us by how this virus is affecting our communities. And so their ability to contribute to a lower spread of the virus has huge benefits for them in preventing school disruption and getting them into their activities and into their social situations that have so many benefits for those kids.
From CBC Radio Canada, Simon.
For Dr. Reimer, why there is only available appointment for kids in supersite? Don't we have enough pharmacies here, especially in Winnipeg?
We absolutely expect that many of the appointments will be happening in pharmacies and in physician clinics. Those appointments are run by the individual pharmacies and physician clinics. There are already many appointments that have been booked at different sites, but we don't have a central booking system, so we don't know those numbers. We will, when the actual vaccines are administered, then centrally we'll know how many kids received the vaccine in those locations. What I can say today is that pharmacies and physician clinics have ordered over 30,000 doses of the vaccine. So that's the expectation, at least for the first round, that's the number of vaccines they're expecting to administer. But they can order every week. And so those numbers should be going up week over week. The pharmacies and physician clinics will start receiving the vaccine, some of them as early as tomorrow, and all of them should have doses by November 29th.
And do you have an idea of how many kids will be able to get to be vaccinated by the end of this week?
Well, that really depends on parents. We have lots of appointments available around the province through our central booking system. So that covers the dedicated vaccine clinics that we run, as well as the urban Indigenous clinics. But the ability of pharmacies and physician clinics is a bit of an unknown. So those numbers will depend on what they have available as far as running clinics, and what parents do as far as how quickly they book those appointments and take their kids in for the vaccine. So we've seen 23,000 appointments booked through our central system already. And we anticipate that those numbers are going to continue to go up in our central system, but even more so, we're going to get a big jump when we start to see the numbers coming out of appointments that don't go through our central system.
Thank you.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. I heard what you said about, the case counts, and they have not been rising exponentially. And yes, in fact, they've sort of roughly plateaued for 2 weeks if you look at the 7-day average. But we have a 17.4% 5-day test positivity in Southern Health right now. We have very high infection rates in both the Southern and Northern Health regions. What gives you the confidence that you don't need more restrictions right now?
Yes, I wouldn't frame it that way, Bart. I think we've been mentioning for quite some time that been certainly concerned with the transmission in Southern Health, the amount of severe outcomes that we're seeing in Southern Health, and then in fact we've implemented more regional restrictions in there. So it's certainly a level of concern right now when you see a test positivity at that level. So I wouldn't say I'm confident that no further restrictions will be required. I'm certainly concerned about that level of transmission we're seeing, especially in the Southern Health region at this point.
Okay, but the reason I guess I was asking is why not today? I mean, some talk that there were discussions of them last week being brought in. Obviously, when the health minister wasn't on the call today, it appeared that was off. But is it simply that our total, not total, but our hospitalization numbers and ICU numbers haven't moved yet? So we're willing to take more of a wait and see approach. I'm asking what specific sort of measures have allowed you to not even come in harder today, especially given what Brittany references, the health minister stating on the 12th of November.
So, I can just say we're certainly concerned and have been concerned, from the public health view of the transmission in that region. So, we're going to continue to, follow things. We'll continue to, work with all involved on how best to address this. Certainly when you talk about things like the ICU, the severe outcomes, certainly that's relevant, but it's not conclusive. I would say that we are, concerned about this level of transmission.
From the Canadian Press, Brittany.
Hi, good afternoon, Dr. Reimer. I'm just wondering, at these super sites or clinics, as they start vaccinating children, especially for the younger ones, heard some parents just worried about getting their kids there and the experience overall. Wondering if anything is being done at these places to, I guess, accommodate or make it a more kid-friendly experience for the children that are getting vaccinated?
Yeah, absolutely. So we're really treating these clinics differently than we treated things back when we had other age groups being opened up, and we're trying to get the maximum number of people through each site as efficiently as possible. We want to continue to be efficient, but that's not our number one goal when it comes to children who are 5 to 11. We want this to be a comfortable experience for them. And so we are doing things differently as far as how children move through our clinics, how many different people they're interacting with, the training of those individuals. So it's not the same sort of line through the facility that many adults experienced when they went through RBC, for example. So there will be more time spent with the children, making sure that their questions are answered, that they're comfortable, that their parents are comfortable. And so we're just really eager to get started with some doses later today.
Thank you. Next one is for Dr. Roussin. Just on the topic of vaccine passports, as the holidays approach, and it's expected or maybe that some Manitobans living overseas will be able to return home or are going to return home. Wondering if anything is in place for those people who have gotten vaccinated but in places overseas, if they'll have any issues visiting restaurants or event centers or anything like that.
So we have provided information to businesses, and we'll continue to update that over time on what is an acceptable proof of vaccine for those visiting Manitoba. So that is available to businesses, and we will continue to update that over time.
From CTV News Winnipeg, Michelle.
Hello, I'm just wondering, Dr. Reimer, why not the 8-week interval for the First Nations children? Is that just based on the schedule? Just maybe explain that.
That was a decision that was made by the First Nations Pandemic Response Coordination Team with the expertise that they have regarding the needs of their communities. But we have had lots of discussions with them about the importance of a faster immune response in children on First Nations communities. They are experiencing higher exposures to the virus. They're experiencing more school disruptions and more severe outcomes than the average Manitoba population is experiencing. So for those children who live on reserve, the First Nations Pandemic Response Coordination Team felt that the benefits of getting the as fast as possible boost to the immune response was more important than the longer lasting benefits of waiting the 8-week period, just because of what can happen between those 3 to 8 weeks as far as the exposures and the outcomes that children might experience in that setting. So it's really about providing the best advice on the risks and the benefits to individual circumstances, and making sure that the way we move forward makes the most sense to the risks that different children are facing around the province.
Thank you. And Dr. Roussin, what would happen if a new variant comes along? Would you start publicly reporting that? I think we've learned, everything's going to change at some point. So is that not necessarily set in stone if there's another variant of concern that comes to Manitoba?
That's right. We will always, adjust our measures, our reporting for what we're seeing in front of us. So right now, like we said, when a greater 98% of cases are Delta, it doesn't really serve a public health purpose. It's not really serving much of a purpose to continue that reporting. We're certainly surveilling for new variants of concern, surveilling for a change in transmission patterns or levels of severity. So certainly, if we see something that makes us change our mind on that, then absolutely we'll adjust our approach.
From CHVN, Taylor.
Hi, good afternoon. Dr. Reimer, I'm wondering if there are any in the 5 to 11 age group, particular ages that are outliers, maybe booking more frequently or less frequently than other ages at this point?
I have not seen a breakdown of booking by age within the 5 to 11, but that's something that we can take away to see if that information might be available.
Great, thanks. And I don't have a follow-up question.
From the Neepawa Banner, Ken.
Good afternoon. Dr. Roussin, I have been told by doctors that really there isn't a treatment as such for COVID-19 directly, but the symptoms need to be treated. I was wondering if you could tell me either now or steer me to a source to let us know what medications, procedures, and treatments are being used in Manitoba, either in clinics, hospitals, or recommended by doctors at home to treat the symptoms of COVID-19.
Yeah, and so this is quite a broad question. So certainly there's treatments that are used for people who are in hospital with COVID-19, been used for quite some time. Steroids have been used for a long time. There's monoclonal antibodies that are used for severely ill patients. There's emerging evidence of the benefit of using monoclonal antibodies in mildly ill patients who are not required to be hospitalized to prevent the need to be hospitalized. So we are looking at that as well. So quite a broad question, and so as far as specific treatments, you could direct that also to Shared Health and what they're using, but that's sort of a broad breakdown of what's happening.
And a second question. Has Manitoba accessed reliable research about the possible effectiveness of vitamin D in either treating or preventing symptoms from COVID?
Well, we have access to all sorts of studies, and we rely on peer-reviewed journals and as well as practices from our colleagues. So we see a lot of information regarding preventative, regarding treatment. So we continually scan that, and so we act upon evidence-based recommendations. Right now, if you're concerned about developing COVID, you're concerned about the pandemic and the effects of some of the responses in the pandemic, my answer to you is clear: is get vaccinated as soon as you become eligible.
All right, we have time for just a few more questions. Please proceed.
So Dr. Roussin, just to further along the projection lines here, we had week over week running average case increases as high as 30%. It's been, as we mentioned, static now for about 2 weeks, a little bit down, a little bit up, but largely in the same 150, 170 range now for the last 2 weeks. How many more weeks of hovering in there would provide you with the confidence to say that the fourth wave is actually long-term plateauing?
Yeah, and so I wouldn't be able to conclude that based on just that. So there's a number of factors. Looking at what we see in other jurisdictions, what our vaccine uptake is looking like. So I don't really have an answer that I can't just simply say the amount of weeks that I would need to see that to be sure, because it can always change. We know that this virus is spread with interaction. As we're getting closer and closer to the time of year where we're going to spend a lot of time indoors. Even if we see a plateau right now, it doesn't mean it can't start ascending again if we start changing our contact patterns. So it's a tough question to give a specific answer to. Of course, we rely somewhat on the models, which at this point are showing an increase in numbers over time.
Dr. Roussin, when we look at test positivity rates, specifically in the South, we've seen 14, 16%, even higher. When we first were in this, you were talking about we should be concerned when we go above 3%. we're well above that in that area with low vaccination. At what point does test positivity trigger something for you?
So, long before this level, it certainly triggers that concern. So we've been messaging, doing what we can to get vaccine uptake increasing, ensure people are being tested. We know that, the real issue with that test positivity is it's a real good indicator that we are missing many, many more cases. If you have this 15% test positivity, it means many cases are not being tested or diagnosed. And we see evidence of that from, a significant proportion of people being admitted to hospital and diagnosed upon admission to hospital that they have COVID. So these are people with relatively significant symptoms for a week or more and still not getting tested. So there's lots of reasons why that the absolute test positive numbers are concerning in that region. The test positivity is certainly concerning in that region, and the proportion of severe outcomes coming from the region are concerning to us. So it's why we've targeted measures in that area, and we continue to work on sort of all aspects of the response.
Dr. Reimer, forgive me if you've already mentioned this today or on Monday, but how many Manitobans have their third doses?
So I don't have those numbers in front of me right now, but we are just trying to work out exactly how we're going to measure the boosters versus their doses for other reasons. So I think you can expect that we'll probably have some numbers in the near future that we'll be able to share with the public about their doses.
And given what we've seen about waning immunity after 2 doses, is it possible, I'm not locking you into this, but is it possible that we'll begin to see booster shots every 6 months or so, or something to that effect? Is that being something, are ongoing boosters being contemplated long-term?
Yeah, and based on what we've seen with other vaccines and immune responses, I think it's unlikely that we would need boosters every 6 months. Typically, what we see, and we don't have evidence this far in the future on this vaccine specifically, but a typical response to a vaccine like this is that you get a big jump in your immune response with the 6-month booster. It's even stronger than after the initial series, whether that's 1 or 2 doses. And then that bigger immune response lasts longer than 6 months. So what I think would be a more realistic possibility is something like an annual, like the flu shot, annual booster to continue to keep that immune level very high. I don't know. I still don't know if we'll be requiring annual boosters. That depends a lot on the virus and whether it changes in a way that's more or less problematic. But it seems very unlikely to me, based on what we know about the body's immune response, that we would have to do something more frequently than once a year.
Any further questions? All right, thanks everyone. This concludes our Zoom session.
Thank you.